Hello, this is Dr. Samuel. I wanted to make a short video, hopefully under 5 minutes, to briefly, I'm not going to be able to cover everything, address the itch in the dogs. So, itch in cats is similar, but it's a different story. So this video we're going to focus on itching in the dogs. Why do dogs itch? Well, there are different reasons, but by far the most common reason is going to be allergy, and allergy is going to be due to three different things. There are three different types of allergy: allergy to the food, allergy to the environment, and allergy to the fleas. Well, first let's get allergy to food or food allergy out of the picture. Let's get out of the way. Food allergy is going to be a dog that's 6 months usually to a year and a half. Once they start itching, they continuously get worse till they're put on a prescription diet. That's the scoop of it. So since that is not the history of most dogs, consequently most dogs do not have food allergy. They have one of the other two types. One is going to be flea allergic dermatitis, or allergy to the fleas, and the other type of allergy is going to be environmental allergy, allergy to the environment, or seasonal allergy. So how do we know that the dog has allergy to the fleas? Well, we try to use good flea medication. Good flea medications recently, in the past like 10 to 15 years, simply mean oral flea medication. Some dogs cannot have oral flea medications, dogs that have seizures, but for the majority of dogs, when I say good flea control, I mean oral flea medication. There are tons of options available today. There is Simparica, there is NexGard, there is Credelio, there is Trifexis, there's Bravecto. All these things are good enough. So a dog that has allergy to the fleas is a dog that when he is on flea medication, on an oral form of flea medication, he will not have the signs of allergy. He will not itch. That's how we know that they have allergy to fleas. The other thing is distribution. Distribution of the skin lesions, the skin problems. Where is this dog having skin problems? Well, a dog that has allergy to the fleas will usually be chewing around his butt, on the lower back, and will be scratching the ears. The paws, not as much. If he's licking his paws, if that's the main part of his allergy, if he's itching, licking his paws, this dog likely does not have allergy to the fleas, but has allergy to the environment, or again to the food, but food has the very specific history that we've talked about. So how do we control environmental allergy? If the dog is on flea medication continuously and is still licking his paws, or getting ear infection, then this dog has allergy to the environment. How do we control that? Well, we control it by one of four methods. There are immune suppressant drugs like cyclosporin, that's the older one. It still has its place where the other ones fail. Then there is Apoquel and Zenrelia. These three are immune suppressant drugs. That's the first category, first class of drugs that we use to control the itch. The second class is going to be injections that stop the itch. The injections that stop the itch are going to be the older one, Cytopoint, works for 4 to 8 weeks, and the average is 6. Then there is a newer one called Befrena, and Befrena works for 6 to 8 weeks, and that means that it works longer than Cytopoint. So that's the second class. Immunosuppressant drugs, the injection that stop the itch, and then there are corticosteroids. Steroids are very good for stopping the itch, but on the long term they would have side effects. So that's why we use them for the short term as an emergency rescue drug if the animal is really itchy. Also, we can use them alongside other medications if the other medications by themselves are not stopping the itch. Finally, there is something called immune therapy. Immune therapy is where we find out what the dog is allergic to through testing, then give him injections of these things that he's allergic to stop the itch. Advantage is it doesn't suppress the immune system, and it can be the least expensive way of controlling the itch, especially for big dogs. Disadvantage is initially it's expensive because of the testing. The testing costs around like $400 if you're just using blood testing. If you use skin testing, that's even more expensive. Another disadvantage is that it takes time for us to draw the sample, send it to the lab, find out what it's allergic to, order the supplies, and then start them, and then there is a loading phase. So if the dog is presenting itching today, immune therapy is not going to work to stop the itch today. Finally, the success rate. Immune therapy of all the other modalities has the least success rate, works on only 70% of dogs. Now there's so much more ground to cover. I will be making more videos, but this is just the scoop of it. Now, one thing that's very, very, very important to realize is that allergy to the environment is a chronic disease. It's like a person who has hypertension. So we're not aiming to cure the dog. We don't have a way to cure the dog at this point in veterinary medicine. We don't have a way to give the dog something that will make him not allergic in the future. That doesn't happen. All these medications, they stop the signs. They make the dog comfortable, they make him not itchy, they make him enjoy his life as a pet, they make you enjoy your pet as a pet owner, but they will not work once they stop. So they work as long as you're giving them. Once you stop the medication, unfortunately the dog will go back to itching, especially as the dog gets older, because as dogs get older, they kind of become more allergic. Again, there's so much ground to cover. We'll try to make other videos. However, if you also want to compare the cost of controlling the itch for your dog, you can just use the calculator that we have on this web page. We made this calculator as just a way to give you a rough idea about how much things would cost. And again, that does not constitute medical advice. We're just trying to give you a rough idea about how much it would cost to control the itch monthly, because unfortunately that becomes a constant expense sometimes. Thanks a lot for listening, and see you in another video. Bye bye.